Welcome to UMCC Medical Consultant Connector, where your health matters to us. Ever wondered what causes the high fever and abdominal pain known as typhoid? This perplexing disease has been a human adversary for centuries. The villain in this plot? None other than the bacteria Salmonella typhi. This notorious bacteria primarily spreads its web of disease through contaminated food and water, making it a common yet avoidable ailment. Now that the cat is out of the bag, and we know the cause, let's delve into the signs and symptoms of typhoid. Typhoid disguises itself well, often appearing as a common fever. But there's more to it. This deceptive illness often reveals itself through a series of symptoms that might seem all too familiar. A high fever that stubbornly persists, a nagging headache that refuses to subside, abdominal pain that makes even the simplest task arduous, and unpredictable bouts of constipation or diarrhea. It's a cocktail of discomfort that can easily be mistaken for a host of other ailments. But here's the twist. These symptoms may not show up until a week or more after exposure to the bacteria, making typhoid a silent but dangerous foe. This delayed onset often leads to misdiagnosis, allowing the bacteria ample time to wreak havoc in the body. So while these symptoms might seem commonplace, they demand your attention. Recognizing these symptoms is only half the battle. Diagnosing typhoid is the real challenge. Diagnosing typhoid is not as straightforward as one might think. This complexity arises from the fact that its symptoms often mimic those of other illnesses, making it a bit of a medical chameleon. Doctors typically employ a variety of tests to detect typhoid, each with its own unique purpose. Blood tests, for instance, are used to identify the Salmonella typhi bacteria that cause the disease. Stool tests, on the other hand, can detect the bacteria in your body's waste. In more severe cases, bone marrow tests might be necessary as they provide the most accurate diagnosis. However, these tests are invasive and are usually only used as a last resort. Diagnosing typhoid might be a challenge, but preventing it is a far more achievable task. Preventing typhoid is in your hands, quite literally. The power to halt the spread of this debilitating disease lies in the simple act of maintaining good hygiene and sanitation. Why? Because typhoid is often spread through contaminated food and water. The simple acts of washing your hands thoroughly and often, and ensuring that your food and water are clean, can dramatically reduce the risk of the disease spreading. But what about those who travel to areas where typhoid is common? This is where vaccination comes into play. Vaccination provides an additional layer of protection and is strongly recommended for those venturing to typhoid endemic areas. Prevention is our first line of defense, but if typhoid does strike, there's a plan of action. Typhoid might be a formidable enemy, but we have the tools to combat it. The first line of defense in this battle is antibiotics. These wonder drugs work by killing the Salmonella typhi bacteria that cause the disease and are usually effective if administered promptly. However, delayed treatment or lack of it can lead to severe complications such as intestinal perforation or widespread infection, highlighting the critical importance of early diagnosis. But the fight against typhoid doesn't end with antibiotics. Hydration and nutrition play a significant role in recovery. Typhoid often comes with severe dehydration due to fever and diarrhea, so replenishing lost fluids and electrolytes is crucial. Likewise, a balanced diet rich in proteins, vitamins, and minerals can help rebuild strength and immunity. So there you have it, an inside look at the world of typhoid, from causes to treatment. Stay healthy, stay informed. UMCC, your ultimate medical consultants connector.